or the Affordable Care Act. So what I'm saying is we have millions and millions of people. Here's what really gets me. People walk up on the other side of the aisle, God bless them, and they act like prior to 2008, 2009, we had a health care system that took care of everybody. Everybody was fine with the current. No businesses were calling our offices saying, man, this health care is destroying my business. I can't plan ahead. It's a 30% increase this year. It's 70 next year. We get one person sick in a small business of 20 or 30 people. We got to go bankrupt. People forget. Millions of Americans, prior to this health care law, 1,700 families in my congressional district went bankrupt because of health care. So we're not even going to talk about that? Are we going to sweep that right under the rug? The kind of suffering that goes on in some of our communities? We're going to drive around the problem, close our eyes? And everyone that says this is a giveaway. This is not a giveaway. This is about giving people who go to work every day, sometimes 2 or 3 jobs, have a sick kid. We're just going to ignore them because we got this bumper sticker on the back of our truck that has 4 little slogans on it, and boy, we can't deviate from that because we'll get primaried by a Tea Party candidate because we can't check every box along the way. But fine, let those 1,700 families go bankrupt. Let that kid with cancer and his parents who are at Akron Children's Hospital or some other children's hospital around the United States have to deal with the fact that they hit their lifetime cap because their child has cancer. Now, give me a break. Because you gotta stick with that bumper sticker. Can't deviate from the bumper sticker that says less government. We want to go back to that great health care system that left 40 million people without any health care, that kept driving up prices for small businesses, small manufacturers in Ohio. We can maintain what is great about the American health care system. I represent a district not far from the Cleveland Clinic. We understand in Northeast Ohio how powerful it is, some aspects of our health care system. But there are failures in our health care system. And we are here as members of the United States Congress to try to fix those holes in the system and try to help our fellow citizens that may be sick, maybe can't afford it, but go to work every day just as hard as everyone else. And I will say, before I kick it to my friend from New York, that I find it very interesting that we have some governors in some of our states, Republican governors in some of our states, conservative Republican governors in some of our states, Tea Party governors in some of our states. One in Ohio was the chair of the Budget Committee during the Gingrich Revolution, Governor Kasich. He makes the exact same arguments for expanding Medicaid in Ohio, which he is fighting for, along with Governor Brewer out in Arizona and some others. He makes the exact same arguments that it is immoral for us to have this level of sickness in our society with people not having access to health care. That it doesn't make any sense for us to wait for somebody to get so sick and then they dump themselves into an emergency room after weeks and weeks of sickness, ending up there much sicker than they should be. He, as well as others, are making the argument that prevention is the way to go. Wellness is the way to go. And I commend these governors because it makes sense. So sit down and work with us to help stand this up, to create more competition, to make sure that these young children and their families don't have to go to bed every night. And this is the last one, now trying to take any help we're giving the congressional staffers, which is floating around here. And I know it's a political hot button, but my goodness gracious, we get young people that want to come to Capitol Hill, live in one of the most expensive cities in the world, make peanuts because they are ambitious and want to get ahead, and we're going to say, you're on your own with your health care too. What are we doing? What are we doing? This doesn't make any sense. And I'm sorry. You know, I'm sorry you don't like President Obama. I'm sorry. You know, I don't know what to say. But to come after health care reform, where so many millions of people are going to benefit. And in Ohio, we're saying 6 out of 10 of the people who are uninsured in Ohio can get health care for less than $100 a month. What's wrong with that? What's wrong with that? Yield to my friend.
Thank you, Representative Ryan, and thank you for expressing the tone of harshness that has prevailed in this chamber. I don't know if I can remember when a standing law in this country was used as a reason to avoid paying our bills or keeping government running. I find it regrettable that we go after the law of the land, in this case the Affordable Care Act. They'll reference it as Obamacare, and we'll see how long that label stands when the program proves successful. It might be removed immediately. But nonetheless, the harshness here is driven after a season's worth of activity on the Affordable Care Act. We have voted for it in both houses of the Congress, bipartisan support in the Senate. President stood for re-election, was re-elected, in immense arguments and debates about repeal and replace by the opposition, by the candidate for president from the other major party. So the people have spoken, and when they elected members to the House of Representatives, the cumulative total of votes for the members of this House were in the majority column for Democrats. So the people have stated they support this. And as Senator McCain indicated on the floor just this week, there are consequences to elections. It's not sinking in, or perhaps it has, but they refuse to allow their behavior to end. It's putting themselves first as political forces rather than the people, what's in the best interest of the people. And I'm concerned, I'm convinced that this is driven by the fear that this Obamacare, as they call it, will be successful. And this is their last effort possible to end the opportunity to provide affordable, accessible, quality health care for all. We know it. We see it in our states. We see it in Ohio. We see it in California. We see it in Florida. We're joined by our friend from Texas who just visited my district this week in Albany, New York, Representative Castro from Texas. We see it in our home states. People have a need out there. In my case, I can cite some of the stats. 36,000 young people will not be biased against with pre-existing conditions from having insurance. Take it away, why don't you? Take it away and then put us at risk of defaulting with our credit rating. Take it away. Be harsh. We look at the 12,000 plus seniors who are receiving discounts for their pharmaceutical needs. Take it away, why don't you? It's unfair, it's un-American, immoral to take it away. But we're going to use it as a pawn in a device here called negotiating on whether or not the government will continue to run, whether we keep the doors open and the lights on, whether or not we're going to pay our bills. Come on, working families in this country understand it. They roll up their sleeves, they play by the rules, they work hard, they expect to taste success, and they pay their bills on time, and they expect their government to do likewise. They don't expect us to put a roadblock in the way that says the law of the land, constitutionally tested in the highest court of the land, in the Supreme Court, given the green light, we're going to put that in the road as a roadblock to stop progress because we know the October 1st starting date is quickly arriving. This is grossly unfair to the people of this country. When I look at the 124,000